Good morning, everyone. Before I start today, there are 3 women in the room that I wanted to thank. I wouldn't be standing here today without them. First is Julia Protus from the San Jose Mercury News. Where is she? She did a fabulous job. Julia, thank you so much. The second is my daughter, my oldest daughter, Julia Gallo, if you could please stand. Julia is a nursing student at the University of San Francisco, and her dream is to actually work at Stanford, particularly at Lucille Packard. Julia, I would not be standing here without you because you, at the age of 16, had to take over my job as a mother of my youngest daughter, 10-year-old Brianna. While I was running around all over Northern California with my very sick child, Julia stepped in as a second mom. So thank you, Julia. And the last woman I like to describe as a good friend and also a guerrilla mom, Diana Fulman. Please stand. She is a guerrilla mother like all of us here, but she's the leader of the pack, as Amy Smith described her and all of us. About a year into Tessa's illness, I went to college in the 80s and managed to not use a computer until this illness struck. And so I was online frantically trying to find people, and I couldn't relate to anyone because Tessa's case was so severe. But a couple of people said, you need to talk to a woman by the name of Diana Fulman. And she called me on 4th of July, which I thought was kind of strange. I'm like, okay, Diana. And she told me that she would be with me every step of the way. And she has. She was at Lucille Packard when Tessa was at her worst. She visited me. She got Tessa the first Cunningham test to be ever taken at Lucille Packard with the help of Dr. Frankovich. And she arranged for doctors all over the nation to talk with us as well as Dr. Frankovich. And to this, my friend, I thank you. When dealing with a disease like this, it's very important to remember that every child is affected very differently. There are mild, moderate, and severe cases. And unfortunately for us, my daughter's case is severe. I am the mother of 3 daughters, and you met the oldest one today, Julia. She's going to be volunteering. We have Tessa, and then my youngest, Brianna. In 2011, Tessa was 13 years old and a 6th grader at St. John Vianney's Catholic School. She was involved in Girl Scouts. She was a star track athlete, an altar server. She was quite the fashionista. She had the lead in the school play and did well in school. In the spring of that year, I did notice some anxiety that would come and go, but we kind of blew it off as end-of-the-year anxiety because of tests and things like that. But our world dramatically changed on July 8th of 2011. My husband and I were away on vacation, and my parents were watching our 3 girls at their beach house. And my mother called me and said, Teresa, I hate to tell you this, but you got to come home quick. Something is really wrong with Tessa. I said, what's going on? She goes, she hasn't slept in 3 days. She keeps on wiping her face like this. We can't get her to eat. I'm even bringing food to her mouth, and the food would just fall out of her mouth. She said that she was repeating the same sentences over and over again about how she wanted her braces off, and nothing made sense. My husband and I flew home immediately, and I couldn't believe when I was on the plane that this was happening, and just wondering what was happening to my beautiful daughter. As soon as we got off the plane, we rushed to pick up Tessa and took her to Good Samaritan Hospital, a local hospital here in San Jose, where they worked and looked over her for about 2 to 3 hours. They were dumbfounded and sent us home with a sedative called Ativan. I was in the parking lot with my husband, and I said, you know what? We're not going home. We're taking her to the best hospital in the world, Lucille Packard's Children's Hospital, right now. And we raced over there, and we spent the next 6 to 7 hours in the emergency room till about 2 or 3 in the morning. They did every test possible on Tessa. They even tested her for strep. Everything came back negative. They told us they were baffled at the end of the night. They gave us Benadryl and sent us on our way and told us to make sure that we saw a neurologist and a psychiatrist within the next week. The neurologist found nothing. The psychiatrist thought that maybe she was suffering from some weird form of anxiety and put her on an anti-anxiety medicine called Lexapro. Within 2 weeks, Tessa was worse, and her psychiatrist told us to take her to a psych facility, Mills Psychiatric Facility. And I said, why? Why Mills? I live in San Jose. Without traffic, that will be at least an hour away from my house. And I found out that day that there are no youth children's psych facilities in Santa Clara County. This is absolutely wrong and totally unacceptable. Tessa was misdiagnosed as bipolar and spent the next 10 months in and out of psych facilities all over Northern California. At this point, I was frantically trying to find a psychiatrist. I wanted the best in our area or the world. And Kiki Chang's name came up. And lo and behold, he was at, I love that man. He was at Lucille Packard. I drove to Lucille Packard. I stood in line with a file this thick and pictures of Tessa and said, please, this is what's happening to my daughter. I need to be put on the waiting list for Dr. Kiki Chang. I was told the waiting list was going to be at least 6 months long. These are the symptoms that we saw in our daughter over the next 2 years. Unbelievable OCD. She would wash her hands till they cracked and bled. She would clean nonstop over and over again. She had a fascination with throwing things out in the garbage. She would pick at her scabs and pimples over and over till they bled and got infected. She had frequent urination. On one day, she urinated 48 times. Eventually, she had lost total control of her bladder, and we had to place her in diapers. She had chorea in her fingers. She suffered from catatonia. She could not swallow or eat. She had terrible separation anxiety from me. She suffered from rapid speech. She completely lost her ability to write, and her cognitive skills went downhill. In the psych facilities all over Northern California, my daughter was the worst case in the ward. She was also usually the only girl and usually the youngest. In psych facilities, at least in Northern California, you're only allowed to visit your child an hour and a half a day. This killed me. And it killed our family, hence the reason why Julia had to help out so much. Because for our family to get to see her, it took about 2 to 2.5 hours to drive to these facilities to visit our child. Our insurance battles began, and they absolutely still continue. We were in education limbo. She was going to a private Catholic school before. There was no way she could do that. I tried homeschooling. We tried special day classes, and eventually had to place her in emotionally disturbed schools. During her first 3 months of being in these psych facilities, I would meet one psychiatrist after another and beg them for a CT or an MRI, and they would not give it to me. And finally, I broke this man down. I just hounded him. This one doctor said, yes, you can have your MRI and CT. And I remember they obviously had to put her out and put her under for this, and I remember praying for a tumor. You know, let my daughter have a tumor. Even if it was cancerous, we would know how to go after it and fight it. But of course, those came back negative. After 8 months in and out of psych facilities, Her outside psychiatrist felt that maybe she was some sort of weird type of bipolar that wouldn't respond to any form of psychiatric medicine. She said we needed to start the paperwork for her to receive electric shock therapy. We were actually hoping we would get that done and started the paperwork. But it never happened, because on the day before Tessa's 14th birthday, I received a call from her school principal telling us to come quickly. Tessa was suspended for hitting everyone in her class. I couldn't believe it, and I raced there quickly. Tessa had never been violent before. I put her in my car immediately and took her home, and she hit me non-stop for 2 hours straight. We ended up back at the psychiatric ward that afternoon. Inside the psychiatric ward that time, I remember the doctors pulling me in and my husband and telling us that they really thought that she was some weird form of schizophrenia. At that point, Dr. Kiki Chang's office called and said that they had an appointment available for Tessa. Mills Psychiatric Hospital didn't want to let go of Tessa. They were afraid that if they discharged her, she would be harm to herself and others. But I discharged her. I took her directly from Mills Psychiatric Hospital right into Kiki Chang's office. Tessa was a complete mess, loaded up on every psych med you could possibly imagine. We had to lay her on the floor at Kiki's office. On the floor, she was in diapers, she was drooling, she had slurred speech, but yet she was lashing out at us and still very violent. He listened to our story intently, and about 20 minutes into it, he said, "I am so sorry it took me to take this long to see you, but I don't think this is bipolar at all. I think this is an autoimmune disease, and I'm going to get you in to see Dr. Jennifer Frankovich." Dr. Kiki Chang also told us that we could no longer, if at all possible, place her in a psych ward. We had to home hospitalize our child. We took her home, we had 24-hour help, we had to lock her in the back room, and we listened to our help being beat continuously until we could get in to see Dr. Frankovich. The day we met Dr. Frankovich for the first time, she walked through the door, this beautiful petite doctor, and my daughter lunged out at her and socked her in the arm as hard as she could. I was mortified, absolutely mortified. And I'll never forget the way Dr. Frankovich handled this situation. She grabbed Tessa by both of the arms, looked up at me and said, "I've seen cases like this before, and I think I can get your daughter back." She ordered an MRI, another CT, a spinal tap, tremendous blood work, and genetic testing. Everything came back negative. She walked into our hospital room and told us she wanted to start prednisone. We said, of course, immediately, right? And she said, no, if I give your child prednisone and she actually has a psychiatric illness, she could get worse. Prednisone, for those who don't know what that is, it's not a psychiatric med at all. It's an anti-inflammatory drug. We took a look at Tessa. She was in soft restraints in a private room at Lucille Packard, and she had to have a one-on-one, and we couldn't imagine her getting more crazy than this, and we said, start the prednisone. Within 24 hours, there was a remarkable improvement. And within 3 months, we had our daughter back. On Mother's Day of that year, my youngest child in the late afternoon told me she had a sore throat. Always on a Sunday, huh, moms? I took her to a clinic, and they informed me that Brianna had strep throat. The next day at school, at around noon, I got a frantic call from her school. I couldn't understand what they were saying. They made no sense. They were crying. And they said, I needed to get there quick. They had never seen anything like this. Tessa lost control of her bladder. She had slurred speech. She couldn't write. And she was hearing voices and talking to them, please come quickly, which I did. And I immediately took her to Lucille Packard. Her doctors felt that Tessa was reacting to just being exposed to strep. Back at Lucille Packard, we had IVIG, steroid pulses, and antibiotics administered, but nothing was bringing Tessa back. OCD came just flaring back, but it was no longer hitting nonstop. She had a compassion and OCD for drinking any form of liquid possible. On her first day back at Lucille Packard, it was recorded by the nurses that Tessa drank 11 liters of water in one day. All water to her hospital room had to be turned off and everything liquid removed from her room. Tessa stopped talking at this time, and we had complete silence. Dr. Frankovich and I and John had a conversation in the hallway at the hospital about how this was no longer possible for us to keep Tessa safely at home. But you know what? There's no places for kids like this. No one wanted to take Tessa on. We could not find a place. And she sat in Lucille Packard until San Andreas Regional Center came forward. And they offered her a room in a group home with 5 severely autistic boys. That was the last place I wanted to put my child, but I had to do it because insurance stopped paying for her to stay at Lucille Packard. By December of that year, Tessa was worse. She had gotten a slight cold, she was still not talking, and her OCD about liquids was out of control. She drank fingernail polish remover, she drank liquid soap and hand sanitizer. I called Dr. Jenny Frankovich on the phone, and she picked up immediately, and I asked, do you think Stanford would approve for Tessa to have plasmapheresis? I knew this was going to be a difficult fight. And then she did, and she said, yes, I can get it done, but I will also give you rituximab. I remember praying during this time. She was in ICU, and they were giving the plasmapheresis and the rituximab. I really felt that this was her last hope. Nothing happened for 2 months, but 2 months later, Tessa spoke for the first time in 9 months. Watching Tessa come back to life was watching a child come out of a coma. Tessa moved home 9 months ago, and she still has flares. We had a very scary one this past December, and I'm scared every day that I could still lose my child. But I'll tell you what, my daughter has a life again. She's back in Girl Scouts. She's in a public school in a special ed program. She's on a in a hip hop class and on a softball team. She's 85 to 90% back. She has changed. She was a totally shy, timid child before, and now she's loud and very talkative. And I've changed too. I have a new passion, and my passion is to bring awareness to this disease, not only for my child, but for all of you here. My passion is also to get our country to open up more youth psychiatric facilities, not only for our mentally ill children, but for all children with autoimmune brain diseases. And I will never forget the only hospital that could and would help my child get better. Lucille Packard's Children's Hospital, Stanford, and Dr. Kiki Chang and Dr. Frankovich, Dr. Jennifer Frankovich, PANDAS Clinic. Thank you.